Hi, so the purpose of this video is to teach you how to use a pelvic wand for transvaginal self-treatment of pelvic floor muscles. So I'll usually recommend the Intimate Rose pelvic wand, which comes in a little container just like this. If you open it up, you'll see the wand inside that looks like this. It's specifically designed by a pelvic physical therapist to help you reach different muscles in your in the pelvic region. So this end tends to be used for treatment of pelvic floor muscles transrectally, which I don't always recommend. So usually when I prescribe this, I am asking patients to use this end to treat muscles transvaginally. Now, first let's talk about setup. So I usually recommend someone is lying down in a comfortable private place. I recommend that they have their feet propped up with pillows, as well as some pillows under their knees and under their butt. By propping your butt up with some pillows, it provides easier access for you to insert this into transvaginally to access those muscles. Now, once you're set up in a comfortable place, the first thing is to apply a generous amount of lubricant onto this. In the clinic, we use slippery stuff, which can be really great. However, sometimes if people have sensitive skin, I will recommend Desert Harvest lubricant, Aloe Glide, which can be really great for people with more sensitive skin that don't respond as well to slippery stuff. Now, when we're talking about treatment with this, we refer to numbers of a clock. So if my finger right here is the vaginal opening, we'll refer to 12 o'clock up here towards the top, 6 o'clock at the bottom, and etc. with all of the numbers going around the clock. So that's how we'll refer to our vaginal opening. Now, to insert this tool, we'll insert it through the opening and we'll refer to different numbers of the clock where we'd like you to apply pressure. Now, there are 3 different depths that I usually recommend people use with this wand. The first one being just this tip right here. So you'll insert it through vaginal opening just until you can see that tip. And you'll apply about 10 to 15 seconds of pressure. But if you're feeling a little more sensitive and you can only handle a couple of seconds, that's totally fine too. So you'll insert the wand at just this first little ridge right here in through vaginal opening. And then I usually recommend, if we're looking at a clock, if this is inserted through vaginal opening, remember we said 12 o'clock is up here, 6 o'clock is down here. I usually recommend from about 3 to 9 o'clock for people to span. So you'd start at 3 o'clock, make your way down to 4, 5, 6, 7, 8, 9. So you'd hold each position for as long as you are able to tolerate, up to about 10 to 15 seconds. All right, so that's covering our first depth. Now it's important to note that I want you to implement self-treatment of these muscles like any other muscles. So whenever you apply pressure to treat them, if you come off and take pressure off and you are feeling worse than when you started, so your pain level or discomfort level is higher than your baseline, that means it's time to either go to a different area to apply pressure or to stop and give your body a break and try in a few hours or a few days. A few hours or a day later. Now, okay, so we covered the clock, we covered the position, and we covered this first depth that you'd want to go in, which is just to this little first edge. Okay, now we're going to cover the second one. The second one is inserting this through vaginal opening until you feel this little curve part hit against, or gently touching against the vulva or the labia. So those lips of the vagina. So again, this is number 1, and now this is number 2, fully inserting. So with that, remember, we're going to go about between 3 and 9 o'clock. So we'll apply pressure in the different areas while we're still inserted at this depth. Okay, now that's our number 2. That's number 2. Number 3 is going to be inserting this to the point where we're going past that curve and getting muscles like this. Now, this is the most difficult one. Oftentimes, this is used to treat a muscle that's deeper named Obturator Internus. Now, if you don't feel comfortable reaching that muscle, that's absolutely fine. It might just take a little while for you to get comfortable with the tool before you feel comfortable accessing that muscle. But I'm going to show you and give you a little bit of tips. So if this is vaginal opening that we're inserting through, I'll do it this way. You'll insert at a sideways. So this little curve is pointing towards one of your legs. Okay, so you'll insert sideways, and then you'll go past the first curve and continue forward. So this little tool is pointing up kind of like at a 45-degree angle up, and the bottom edge will be positioned underneath your opposite thigh. Okay? So let's review that again. We'll try it from the other side. So if you're going to switch sides, you take it out, rotate it to the side again. So if you note this little aspect is poking out towards the side, you'll insert it to that where you feel that curve in the tool, hit labia. Then you'll continue to insert, so this goes up at about a 45-degree angle, and then this bottom part will be underneath your opposite thigh. And you can apply pressure there, okay? Now, you know how we talked about the rules from about 3 to 9 o'clock being our standard? Now, what I want you to avoid is 6 o'clock in general. The only exception to that rule is with this first this number 1 depth where we just insert at the tip, because we have some really important muscles called superficial and deep transversus. Anyway, you don't need to know that, but there are a couple of muscles that are important for you to reach at that 6 o'clock at this first depth. But if you go in further and you go to where this first curve will be touching labia and you apply pressure downward at 6 o'clock, that's going to be applying pressure directly onto rectum. And we just want to avoid that. So we protect rectum and we don't irritate it at all. So you can go to the sides at about, 5 o'clock or 7 o'clock. Okay, so to review, you're going to be lying down with pillows under your butt and your legs propped up and comfortable so you don't feel a strong stretch while you're doing this. You're going to apply a generous amount of lubricant on the whole thing, or at least as far as you're going to go in, even if you just hit the number 1 depth and the number 2 depth. You're going to apply gentle pressure with your hands for about 10 to 15 seconds, and make sure you take a break every time after you do that to see if you're feeling better or worse. If you're feeling better or about the same at your baseline, after you take a break from it, you can continue treating that area or the surrounding areas. And if you're feeling a little bit more uncomfortable or painful than your baseline, that means you either need to move to a different area or just take a break from the self-treatment completely until the next day or even a couple hours from then. Okay, now to review, we have our 3 depths. We're gonna go in just to this little tip. That's depth number 1. Depth number 2 is going until you feel the curve hitting labia on the outside. And then number 3 is inserting past the second curve at this 45-degree angle up with this bottom part underneath your opposite thigh. Okay, so if you have any questions, review it. If I'm your physical therapist, review it with me or chat with your physical therapist if you do have any questions about it. Now, oftentimes there will be certain precautions or certain areas that we want to avoid, whether it's a place that we had surgery or a place that's a little more sensitive. So this is a general recommendation I usually give to my patients. However, if there are any things that I want to avoid, I'll tell them specifically and instruct them on how to do that.